injury case, and this summer I have been working with graduate students Sol Lim and Professor Clive D'Souza on a validation study of accelerometry for ergonomic posture assessment. Awkward postures and high force exertions are risk factors for musculoskeletal disorders in a work setting. Our lab uses tri-axle accelerometers and 3D motion capture systems to validate the use of these accelerometers for ergonomic posture assessment in a simulated work environment. Eventually, our hope is to implement these accelerometers in the field for occupational biomechanics research. An example of this would be analyzing forces and postures in the hospital nurses and staff when caring for patients, specifically in the transporting of heavier patients. Let's take a look at one of our experiments. Optical reflective markers were attached to the participant's body at specific locations, including the head, the shoulders, the knees, the hips, and the ankles. These markers let us capture and analyze participant movements in 3D space using a motion capture system. 5 accelerometers were also attached to the participant on the sternum, the upper back, the L5-S1 joint, the right arm, and the right leg. We studied 4 commonly occurring tasks and body movements that involve awkward postures and forceful exertions during manual work and are known to either cause work-related injuries or can lead to potential injuries. Participants were asked to push or pull a handlebar. Their posture was recorded during isometric hand force exertions in either a one-hand or two-handed grip. 3 force exertions were measured at 3 handle heights, including the shoulder height, the mid-back height, and the hip height. For the sit-stand task, participants were asked to sit on a platform and return to a standing posture. Posture was recorded at 2 platform heights, knee height, and 70% of the knee height. This task will be used to determine whether the accelerometers can detect differences in sit-stand kinematics. For the lifting task, participants were asked to lift a loaded box using 2 lifting techniques, a stoop and a squat technique. There were 3 different weight conditions at the box, a low, medium, and high, which was determined by the participant's low back maximal voluntary contraction data. Lastly, for the walking task, participants were asked to walk 2 laps of the track with either a loaded box at the 2 lowest weight conditions or no box. Participants walked at a comfortable pace.
So for this part of the project, I am working with the motion capture data, and I'm trying to find the Euler angles of rotation. So if I were to move forward and back, I want to find what angle that is using 3 marker inputs. Eventually, we're going to use the information and line up the angles from the motion capture with the YEIs, or the inertial sensors IMUs.
I am currently working on processing all the motion capture data, as well as working with my fellow research assistant Chan Mi and determining the best possible solution to time sync the 2 data sets. We'll use this to validate all of our studies. If successful, these inertial sensors can be used independently in subsequent field-based ergonomic job analysis.